Hey everybody, it's Luke Gordon here, another video about total knee replacements. And one of the most common questions I get from clients is, can I avoid total knee replacement surgery? It's a really good question, I think, for a lot of people, especially just given the fact that a total knee replacement is a major surgery. So I'm going to answer that question today and tell you what I think, because I think some people can and I think some people can't. So I'm going to differentiate who I think can and who I think can't, and hopefully that will apply to you. And I want to tell you about a story of a client of mine that I had a couple years ago who was able to avoid surgery and what it looked like for her. So I'm going to tell you those things in today's video. Before I do that, if you wouldn't mind just giving me a quick thumbs up and subscribing to the channel, and obviously I would appreciate any comments below after the video. So first off, some people can, I think, and some people can't. Let me tell you about this client that I started working with about 2 years ago. So she was referred to physical therapy before a total knee replacement, because nowadays a lot of our clients have to lose weight before they go into surgery. So she was referred in, she needed to lose, I believe, about 30 pounds to get her BMI to the acceptable level. And we won't go into details too much in terms of like why that's required by the surgeons. I'm going to do a different video on like losing weight before surgery too. But that's why she was referred in. So she actually came to aquatic therapy, which is a great way to exercise when your knee is that painful, because she really couldn't exercise on land, which a lot of people, prior to a total knee replacement, the knee is super painful and they can't exercise on land that well. So again, she was coming into the pool. So the doctor says you need to lose 30 pounds and then we'll do the surgery. So the doctor also recommended, in order for her to lose those 30 pounds, he recommended the keto diet or ketogenic diet. So maybe some of you watching have heard about that diet or read about it, but essentially keto is like super high fat diet. If you Google it, you'll find all sorts of recipes. They include like a lot of butter, a lot of cheese, bacon, high fat meat, stuff like that. Similar to like the Atkins diet, but maybe slightly more healthy in terms of like higher quality fats and things like that. So anyways, she starts exercising in the pool. She likes the pool. That's great. And then about a month after doing the keto diet, she had lost a little bit of weight, but her knee felt significantly better, to the point where she was walking fine. She could squat pretty well all of a sudden, things that she hadn't done in roughly 3 years. She's like a 3-year-old injury. She got hurt at work. Anyways, so she was able to all of a sudden, she was fine. So she ended up not having to do surgery. I believe she ended up losing roughly 30 or 40 pounds. But at that point in the game, this is the important part, I think. At that point in her journey, she really hadn't lost much weight. She had maybe lost 5 or 10 pounds. So you might say, well, losing weight, will that help me, avoid surgery? I'm going to make a video about that too, actually, because I think it's an important topic for another day. But in her case, she really hadn't lost enough weight to make you think that she had taken a lot of pressure off her knee, and that's what led to her feeling better. So why was it then that after, 3 to 4 weeks on this keto diet, why did her knee feel so much better, and why was she able to avoid surgery? So let me tell you what I think. In her case, what I think, with my history and my background with natural health and anti-inflammatory diets and stuff, I think she took probably 1 or 2 key foods out of her diet that were really causing inflammation, not just in her knee, but throughout her entire body. Now, in this case, her biggest pain point was her knee, so that's where she felt the most dramatic effects. But essentially, when she went from her standard, what I would call like the standard American diet, which is a lot of processed foods, a lot of sugars, a lot of carbs and empty calories, when she took the majority of that out of her diet and then she replaced it with high-fat foods, again, if you Google any of these keto recipes, there's just lots of fat and a good amount of protein, but like basically no carbs. She was going for like less than 40 grams a day. But when she did that, I think she took out 1 to 2 foods, which could have just been sugar, that were inflaming her, and that's what led to her feeling better within a month. So pretty cool story. And I think what I would say to you, if you're watching and you feel like you're getting close to total knee replacement surgery, or even potentially if you've had surgery and you're still hurting, I would strongly encourage you to consider that there could be 1 to 2 foods that are really bothering you to the point where they're inflaming you. Start researching what they are. If you want to know more about that, comment below the video. I'm happy to tell you what I think, because I really have quite a bit of a background in this kind of thing. Since I have rheumatoid arthritis and I do an anti-inflammatory diet, it makes me feel significantly better. I do know a lot about what foods to target first, what types of recipes are going to, potentially help. So to wrap up today's video, I think that is a very viable option if you're hoping to avoid total knee surgery. I don't think it'll work for everybody, but if it was me, I would give it a shot. I mean, even if you just said, look, I'm going to try a different diet for 2 months, and if it makes me feel better, great, and if it doesn't work, it doesn't work. You don't have a lot to lose, in my opinion, and you do have potentially a lot to gain. Now, again, I don't want to give you false hope, because I do think sometimes your knee is just completely shot. It's completely bone-on-bone arthritis. There's not a lot you can do about it, and you just are going to have to, choose if surgery is right for you or not. But again, to me, it's worth a shot. Now, this same client of mine, she's doing a high-fat diet. Maybe high-fat diet isn't the best thing for you. Maybe you just want to really target like cutting out processed and refined sugars, artificial sugars, and gluten. Something like that. So anyhow, I do think it is possible for some people to avoid total knee replacement surgery. And I think a lot of people who are about to have surgery are pretty motivated to give it a try, because surgery is a big deal. So anyhow, again, thank you for watching the video. I hope it helps. I'm going to make a couple more videos about the topic, about losing weight before surgery and some other tips and techniques. But again, if you have any questions, please just leave me a comment below the video. And I hope you have a great day. Thanks.